Welcome. My name is Rick Wessler. I'm the program director for the rural training track in family medicine in Willmar, Minnesota. What initially drew me to primary care, especially rural primary care, is the ability to develop relationships with people. I had spent time during medical school in a small community, actually in Willmar and in New London, Minnesota, where I currently practice, and was able to see the power of relationship development. I think what's really exciting about having a rural training track, that training can happen in rural areas. The majority of medical training happens in urban centers. There's excellent pathology in urban centers, there's excellent training there, but there's a piece that we think we can augment or that we can add to that training by having trainees in a rural environment. The reason why rural healthcare is important and why rural training is important is when you just starting with basic statistics. More than 20% of people live in rural areas, and less than 9% of physicians practice in rural areas. I think residents and young physicians, one of the reasons why they stay in rural areas after they spend some time training there is that it's a great place to be. It's a great place to raise a family. It's a great place to educate your children, and it's a great place to work. As we develop the curriculum, we're really getting excited about what this is going to mean. Our focus is going to be training young physicians who can practice anywhere, but who can very skillfully and effectively practice in a rural area. And what that means is the ability then to provide maternal care and OB care, but through the lens of a smaller facility and a small community. One of the reasons why we think it's a wonderful opportunity to establish a rural training track in Willmar is our long history of being involved in academics and in being involved in medical training. We have had medical students through the University of Minnesota and other medical schools in the Willmar community since going all the way back in time to when some of the rural training programs started. In addition to the training opportunities for physicians, we think that Willmar and West Central Minnesota is a great place for young families to be. So for physicians that have a family, that are looking for a place where their children can integrate into the school system very smoothly. If people enjoy outdoor activities or lake activities, the trail systems, the park systems, there's just so many excellent opportunities for young families to grow and develop while their loved one is engaged in medical training. So we think that the rural training track in Willmar and the development of that training track is going to fit really nicely into the regional development of additional medical training. The University of Minnesota will be opening a branch campus of the University of Minnesota Medical School in St. Cloud, starting with their first class in 2025, which correlates with the first year that we will have new family medicine residents in our rural training track here in Willmar, and we fully expect that adding medical school and adding the residency is just a part of the development of broad spectrum, multidisciplinary medical training in rural Minnesota. So as we work toward getting the program ready to launch and ready to have residents in our community and training amongst all of our physicians and our medical staff, the excitement is continuing to build, and we are so excited to launch the program and to have our first residents here starting in July of 2025. Please reach out to us at any time.